So when patients have hip arthritis that has not responded to conservative care, and it's gotten kind of to that bone-on-bone point, and the pain is to the level that they're ready for intervention, typically what we do is a hip replacement. And the hip replacement basically entails cutting the ball of the hip off and replacing it with a new ball, and cutting, putting the stem into the bone, putting a new ball on, and then putting a new socket in. Basically, we take a reamer in and we ream the socket and we put a new socket in, and then we put it back together. The interesting thing about hip replacement is the recovery is pretty quick. The pain is better almost the next day in most patients. How do we do this? I actually personally utilize the robotic hip, where we take a CT scan of your pelvis and your hip, and we actually recreate a three-dimensional image of it, and we then utilize different sort of trackers in surgery, and we marry the CT scan that we took before surgery with what we find in surgery, and the robot actually helps us to position the cup in the exact right position. This is important because that's what we do to try to prevent dislocation and try to optimize the long-term use of that hip.